painful periods, heavy bleeding, struggling with infertility, you could be dealing with endometriosis without even knowing it. In this episode of Good Health with Badr Samaa Hospital, we are covering what every woman needs to know. And for that, we have with us Dr. Beena Karunakaran. So doctor, before we begin, can you explain what endometriosis is?
Endometriosis you have to understand because it's a difficult condition causing severe pain, infertility, things like that. So we start off with the question, what is endometriosis? So you need to understand that the word endometrium means the lining of the inner lining of the uterus. This is what is shed every month when we bleed, the lining. So in some people, the endometrium goes out through the fallopian tubes and get deposited in the ovaries, in the pouch of Douglas. It can deposit anywhere in the body except the spleen.
So what are some common symptoms? What do we look out for?
Endometriosis is a peculiar condition in the sense like you may not have anything inside your abdomen, but you may have big symptoms and you may have big cysts which are sitting silently. So I had a patient with 12 centimeter cyst which was found when she was pregnant. So you see, some patients have severe pain, but the cyst may be only 2 centimeters. So the cyst and what we find inside may not correlate. Common symptoms will start from the adolescent age. They may have pain. Usually pain is for 1 day on the day of periods. They may have pain before around 1 week, which subsides after bleeding. Then they may have infertility. They may have heavy bleeding and things like that. About infertility, I want to stress that all endometriosis do not cause infertility. Some people have pain during intercourse, pain during passing stools, some have irritable bowel syndrome before the periods, bloating and things like that. So if you have excessive bloating also, you please come. Scan may be normal, but there are some other tests which I'll highlight subsequently.
So doctor, take me through the entire evaluation process.
Now we go to the evaluation. Evaluation as usual starts with physical examination, but we should never underestimate the value of a clinical examination just because there's ultrasound and MRI. Clinical examination, we ask the symptoms and we check and find out whether her symptoms correlate with our findings. So in clinical examination per abdomen, you look for any mass like an ovarian cyst, and then when you do a pelvic examination, which we should never skip, we see the cervix and we do a pelvic examination and check for tenderness in the fornices if there are cysts, tenderness in the pouch of Douglas because there may be nodules there. Patients sometimes have pain during intercourse, so we should correlate with that. And then next is the investigative techniques which we have. So in that there are 3 main things. One is ultrasound, MRI, CA125 is a good marker which can correlate with the scan finding. So ultrasound, basically we get it done for most of the people. Now it's like an extension of the physical examination. So once you find out there is endometriosis or adenomyosis, especially for adenomyosis, we can go to the next level of investigation, that is getting an MRI done. Then of course the blood test. So that finishes the evaluation.
Doctor, final question. Let's talk about treatment.
Correct. That's the most important aspect. So coming to the treatment aspect, I would say endometriosis is difficult to treat once it's established. So we have to target the adolescents. We should focus on prevention. So once a girl comes with dysmenorrhea, please bring her, we evaluate and we focus on diet and lifestyle change. In diet, as you know, all children are eating too much of junk food and chicken. We cut down all these things and give our natural cultural foods and include lifestyle changes from young age. Put them for some yoga, some cycling, some karate. Don't make them sit on the mobile. Okay, if they have passed that phase, they have come after marriage. And if they're not having babies, young couples, please give them time, at least 1 year. Older couples, if you see obvious cyst, then you are justified in doing a laparoscopy because these tubal adhesion cysts might prevent pregnancy. But after 1 year of trial, unless the cyst is very big. And last, of course, if they have completed the family and the lady has adenomyosis, you can suggest a hysterectomy, but the point is we remove the ovaries because the culprit is the ovary, and the ovarian estrogen will, progesterone and estrogen promote the growth of this. So you see, endometriosis comes with us gynecologists from adolescence to menopause. So the patient is there throughout, but please cut it at adolescence. So that's all, dear.
Now we know what to do.